we've exhausted the goodwill of people in the NHS and care sector, and the stress that people have been under during COVID has had a huge impact on staffing levels, because you've got people now with burnout, people on long-term sick, and that creates more stress within the remaining staff.
I think nurses, we need to not be seen as cannon fodder. We need to be seen as like, I think people talk about us as all valuable clinicians, but actually we're the clinician you can chuck at anything. And actually there's so much stuff that we can do if we're given the time and space to. We're not the people that should just plug the gaps. We're the people that can, build upon them.
It's the passion that the staff on the ground have. We hear more of the negative things and we forget about the hardworking staff that are out there in the health and social care profession.
Sitting, talking to patients is vital, but there's just no time for that anymore.
As carers, we care too much. And because of that, we carry out all sorts of tasks that really we shouldn't. We should get help and support with, but we don't. We just care too much. And I always say it's not the caring actually that gets you down. It's the constant fight with social services to get what actually they should be giving.
They felt they were knocking on doors and getting turned away. And so it then led to mental health issues for the carers because they were desperate, basically.
Alongside being a clinical nurse, I was also a trade union rep. So I was like trying to represent people who had no voice in the NHS. And I had a place at the trust board, so I had a first line opportunity of addressing issues on behalf of the staff in Cardiff and Vale. And the one thing that I kept saying over and over and over again is about when people use this expression top down, bottom up. I to say to the board executives, by using that expression, you are implying that I am the bottom. And that really upsets and insults me, because if you decide not to come to work tomorrow, would it make a huge difference to this organisation? But if I choose not to, or if the cleaner of our unit or any ward chooses not to, it would make a huge difference.
In one of the specialist units that one of the staff was in, she said it takes 8 to 12 months to find a specialist surgeon in their area, and they literally got 2 specialists place vacancies that have no chance of being filled for another 12 months. So again, it's not just the specialists, it's the impact on the administrative staff who are having to say no to services that people really have a right to expect.
There's not enough of us, and those of us that there are, we're completely overwhelmed. So any form of development or enrichment of your basic role, there's no space for, because you're chasing your tail to even complete the basics.